Hello and welcome to Care Conversations, brought to you by Nurse Registry. This is your trusted space for straightforward and useful health topics that matter the most to you and your family. From managing chronic conditions to understanding what quality nursing care really looks like, we're here to empower you with knowledge that makes a difference. I'm glad you're here. Let's get started. Today, we're going to talk about something that over 450,000 Americans undergo every year: hip replacement surgery. If someone you care about is scheduled for a total hip replacement, or if you're weighing the surgery yourself, you probably have one burning question: how long is this going to take? And here's the honest answer. Most people recover from a hip replacement within 6 to 12 weeks for basic independence, though full recovery, such as returning to everything you love, all your favorite hobbies and activities, can take up to 12 months. Now, I know that's not the simple answer you were hoping for, but here's the thing. Hip replacement recovery isn't a single finish line. It's a series of milestones, each building on the last. And knowing what those milestones look like, week by week, is what turns an overwhelming process into a manageable one. Today, we're going to walk you through exactly what recovery looks like, from the first 24 hours after surgery to life at the 1-year mark. We'll cover the factors that speed recovery up or slow it down, what physical therapy demands of you, which warning signs to watch for, and how in-home nursing care can make the difference between a smooth recovery and a complicated one. Whether you're the patient or the person holding their hand through it, you'll leave here knowing exactly what to expect. So, let's dive in. Before we talk about recovery, let's quickly cover what actually happens during hip replacement surgery, because understanding the procedure helps you understand why recovery looks the way it does. Hip replacement surgery removes your damaged hip joint, that's the ball and socket joint, and replaces it with a prosthetic implant. These implants are typically made of metal, ceramic, or high-grade polyethylene. The procedure itself usually takes 1 to 2 hours. Your surgeon removes the femoral head, that's the ball part at the top of your thigh bone, fits a metal stern into the thigh bone, and seats a new cup into the pelvis. A ceramic or plastic spacer sits between the two components, reducing friction and restoring smooth, pain-free movement. Now here's something important. The surgical approach your orthopedic surgeon chooses directly shapes your early recovery. There are 3 main approaches: anterior, which comes from the front, posterior, which comes from the back, and lateral, which comes from the side. Anterior approaches tend to spare more muscle tissue, which can mean fewer movement restrictions and a faster return to independent walking. Posterior approaches are more common and highly effective, but they do require stricter hip precautions in the first 6 weeks to prevent dislocation. So understanding which approach your surgeon plans to use is one of the most important pre-operative conversations that you can have. So don't be afraid to ask about it. All right, so let's talk about what recovery actually takes. Hip replacement recovery takes between 6 weeks and 12 months, depending on the patient. That's a wide range, I know, but here's what's interesting. Most people experience a dramatic reduction in hip pain within days of surgery. That part surprises almost everyone, and honestly, it's very fortunate. But there's an important difference between feeling better and being fully recovered. Feeling better means the chronic pain that drove you to surgery is gone. So you're sleeping better, you're not wincing every time you stand up, and you're thinking, wow, I should have done this sooner. But fully recovered means the muscles around the hip have rebuilt their strength, your gait has normalized, and you're safely returning to all the activities you love, whether that's gardening, golf, or playing with your kids or grandchildren. Several variables determine where on that 6 to 12 month spectrum you land. Now, age plays a role. Patients over 70 sometimes take longer, though that's far from a guarantee. There's definitely been 75-year-olds that bounce back faster than some 50-year-olds. Pre-surgical fitness matters greatly. The stronger your hip muscles going into the operating room, the faster they rebuild afterward. And then you have to consider comorbidities like diabetes, obesity, and cardiovascular disease. So let's break down what recovery looks like phase by phase. And let's start with the first 24 to 48 hours. Most hip replacements are now performed as an outpatient procedure, meaning many patients go home the same day they go in for the surgery. If you stay overnight, it's typically just one day. And here's something that surprises a lot of people. Within 24 hours of surgery, your care team will have you standing and taking your first steps with a walker. Getting moving reduces the risk of deep vein thrombosis, which are dangerous blood clots. It prevents joint stiffness, and it signals to your body that healing has begun. You're not running a marathon here. We're not standing up, taking a few steps, and then sitting back down. But those steps matter tremendously. Let's move to week 1 and 2. This is the early home recovery phase. So once you're home, the focus shifts to wound care, pain management, and controlled movement. You'll likely still be on a prescription pain medication and applying ice in 20-minute intervals and keeping the leg elevated to manage swelling. Physical therapy will likely begin almost immediately, and by that, I mean day 1 or 2 at home. These are gentle exercises like ankle rotations, quad squeezes, and straight leg raises that prevent the joint while rebuilding circulation. This is also when you need to watch carefully for signs of infection. That may be increased redness, warmth, discharge from the incision, or a fever. If you have any of these warning signs, you need to call your surgeon immediately. Your daily routine looks very different during this phase. You're using a walker for all movement. You're being extremely careful about hip precautions, like don't cross your legs, no bending the hip past 90 degrees or twisting at the waist. And you'll likely need help with basic activities like showering, getting dressed, and preparing meals. This is not a time to act like a hero, okay? Accept the help when it's offered. That can help greatly. Weeks 3 to 6 is all about building independence. This is where recovery starts to feel real. Pain medication tapers off. You're moving more confidently. And many patients receive driving clearance from their surgeons around the 4 to 6 week mark. Physical therapy intensifies during this phase, progressing to stair climbing, hip abductions, and gait training. You may graduate from walker to a cane, which honestly is a huge milestone. Daily activities like cooking, dressing, and light housework become increasingly manageable on your own. But here's the thing, reminder, you are not done yet. This is where some people make the mistake of thinking, I feel great, I can stop doing my exercises. Please don't do that. Just like how every doctor tells you to take your medicine even beyond the point of where you're feeling better until your prescription is done. You need to keep doing these exercises. You have to keep going until the full length of physical therapy is finished. Months 3 to 6, and this is about strength and stamina. By this mark, most patients have returned to desk work, light exercise, and normal activities. The new joint is functioning well, but the surrounding muscles are still rebuilding. This is an important distinction. Your hip joint itself might be perfectly fine, but the muscles that support it and allow you to move properly need more time. Outpatient and physical therapy continues with increasing resistance and functional training. Low-impact activities like walking, swimming, and stationary cycling are typically cleared well before the 6-month mark. Now, high-impact activities like running, jumping, heavy lifting, these remain off the table until your surgeon gives you explicit clearance. Your new hip is tough, but it's not indestructible, and you want it to last. Now, 6 to 12 months to full recovery. The 12-month mark is generally considered full recovery. Most patients are pain-free, walking without any assistive device, and back to the lifestyle they had before arthritis or an injury took hold. Studies show that roughly 90 to 95% of hip implants are still performing well 10 years after surgery, and many last a lifetime. Your surgeon will continue to monitor the implant with periodic follow-up appointments. But for most people, this is the chapter where the surgery becomes a distant memory. You're back to doing the things you love. You're sleeping through the night. You're moving without pain. That chronic ache, that defined your life for years, it's gone. All right, so Now that we've talked about the recovery timeline, let's talk about warning signs that you need to pay attention to. Because even though they're uncommon, they're not so rare that you can just ignore them. So, one is deep vein thrombosis. Again, we mentioned it earlier. It's a blood clot forming in the leg veins. It is one of the most serious risks in the weeks following surgery. Symptoms include calf swelling, warmth, or unexplained pain in the lower leg. If you experience any of this, please call 911. This is not a wait and see approach. 2, surgical site infection. This can appear in the wound, surrounding tissue, or the joint itself. You may experience fever, increasing pain, redness, or any foul-smelling discharge. Again, please call your surgeon. 3rd is hip dislocation. This is another complication to take very seriously. This is where the prosthetic ball slips out of the socket. It's more common with the posterior approach, which is why hip precautions exist. And 4, nerve damage. This can cause numbness or weakness in the leg and may require additional evaluation if symptoms persist. Now, I'm not sharing this to scare you. It's all about being educated. Most people don't experience these complications, but you need to know what to watch for, so if you do experience it, you can act quickly. Now let's talk about home recovery versus skilled nursing facilities. After discharge, patients typically have 2 options: recover at home or transfer to a skilled nursing facility. For many years, skilled nursing facilities were the default recommendation for older patients or those without a strong home support network. Well, that's changing. Research increasingly supports home-based recovery for appropriate selected patients, and the data makes sense. Recovering in your own comfortable environment reduces exposure to hospital-related infections, supports better sleep, and tends to produce stronger motivation to progress through therapy. The catch is that home recovery only works when the right support is in place. A well-meaning family member can't always replace the clinical judgment of a licensed nurse. That's where professional in-home nursing care becomes not just convenient, but genuinely protective. So how does that work? A private duty RN or LVN does far more than just provide companionship during a recovery, because that's more like a caregiver role, right? This RN or LVN, they serve as the clinical link between the hospital, the orthopedic surgeon, and the physical therapist, catching problems before they become emergencies and keeping the recovery plan on track. At Nurse Registry, we connect you with licensed nurses who provide post-surgical care that covers the full scope of what recovery demands. That includes surgical wound assessment and care to reduce infection risk, medication management, including blood thinners prescribed for DVT prevention, monitoring for early warning signs of infection or dislocation, and coordinating communication with your orthopedic surgeon and physical therapist. With over 500 licensed RNs and LVNs across California, Nurse Registry matches patients with nurses whose experience fits their specific post-surgical needs. Our team is available 24/7 and scheduling is flexible, whether you need around-the-clock care in the first week or a few hours of support each day during the intermediate recovery phase. So hip replacement recovery isn't something you push through by sheer willpower. It's structured and phase by phase, rewarding preparation, consistency, and the right support. Most patients are genuinely surprised by how quickly the pain that brought them to surgery fades, and equally surprised by how much work rebuilding full strength and mobility requires. Both realities are true, and they both deserve to be honored. You will feel better quickly. The chronic pain will likely disappear within days. But again, rebuilding strength and returning to all your activities takes time and commitment. If you or someone you love is heading into hip replacement surgery, start preparing now. Strengthen those hip muscles. Line up support systems. Ask your surgeon about their surgical approach. Understand the recovery timeline. And remember, you don't have to walk this journey alone. Professional support is available, and it can make all the difference between a smooth recovery and a complicated one. Your hip replacement is an investment in your future mobility and quality of life. Give it the care and attention that it deserves. Thank you for spending time with me today on Care Conversations. I hope this episode gave you valuable insights and practical takeaways that you can use. If you found this helpful, please subscribe and share it with someone who might benefit. Remember, quality care starts with quality information. And whether you're managing your own health or caring for a family member, you don't have to navigate alone. For more resources and expert nursing care, visit nurseregistry.com. But thank you so much for listening, and until next time, take care.